Hi. Okay, so this is me. This was before pregnancy. My husband and I hiked across Spain, so I was always very, very active, and I wanted to maintain that activity while I was pregnant and after as well. I also do a lot of running. I've been involved in several races, and this is one race that I did, obviously, after my kiddo was born. But I also went back to hiking. My kid comes with me. It's pretty fun. His name is Kai. He's just awesome and lovely. And while I was pregnant, I was, I knew a lot of the information that I'm about to give you guys tonight, but it didn't really make that nearly as much sense as it does now, okay? After having gone through all of this as well. Even being a physical therapist and really knowing mechanically what I was up against, it's not the same as experiencing it. And so I'm hoping to be able to pass on some of that knowledge to you so that you feel very empowered by the end of tonight. Okay, so this presentation is informative only, okay? This is not designed to replace any kind of clinical evaluation that you may or may not need. If you have any pain, please feel free to schedule an appointment with us. One of our physical therapists would love to work with you and make sure that you're able to get through your pregnancy as pain-free as possible. All right, so we have a couple of objectives for this evening. The first thing I'm going to go through are some anatomical changes. First, we'll just do like super basic anatomy. Then we're going to go through some of the changes that you'll be going through during pregnancy. This is also really helpful for the guys in the group because I think it's really hard to relate to a pregnant woman at all. And so once you have a little bit more knowledge, then it makes a little bit more sense why it's really hard just to put on your shoes. We'll talk about some of those changes. We're going to talk about some postural techniques. You may have noticed, especially for those of you who are much farther along in your pregnancy, you may have noticed that your posture is way different. So we're going to talk about certain techniques that you can do to maintain better posture, to make sure that you don't develop any kinds of pain, and things that we can do just to maintain that good stability overall. We're going to discuss some exercise recommendations. This is very, very general. In physical therapy practice, we always like to prescribe exercise based on your individual needs. So the stuff that we're going to be talking tonight about is really, really basic stuff. Okay. We're also going to discuss how physical therapy can help you throughout your pregnancy and some of the other programs that we have available here at Breakthrough to allow you to be as fit throughout your pregnancy and thereafter as possible, okay? At the very end, we're going to do a little lab. We're going to discuss some breathing techniques because breathing does get harder as we get farther along in pregnancy. I remember sitting in my car on my way home from work being like, okay, I can't get enough air, but I'll be able to make it home. We'll be okay. I can get out of the car in a little bit. We'll talk about some pelvic floor contractions, how that's going to benefit you throughout pregnancy and beyond. We'll talk about squats and a sit-to-stand technique, and we're also going to do a very light abdominal exercise, okay? Those abs change a ton throughout pregnancy. That contributes to some of the dysfunction that we tend to see throughout pregnancy and beyond. And so I want to give you guys just a couple little tools that you can walk away with, knowing that these are safe exercises to do, unless, of course, your OB has instructed you otherwise. Always go by whatever your OB says, okay? All right, so on that note, let's launch into some very basic anatomy. We're going to look at the spine. It's consisting of 24 different vertebrae. In between each one, we have intervertebral discs. They really act as cushioning devices for when you're walking or making any kind of impact at all. We also have a ton of ligaments and muscles attached to these vertebral bodies. Okay. They assist with stability, they assist with movement, they will change as you're pregnant, they change as we change positions. Also, at the very bottom of our spine, you can see we have the pelvis here. This obviously undergoes an awful lot of changes during pregnancy. We'll talk a little bit more about that later. But it consists of our two pelvic bones on either side, the sacrum in the back, tailbone at the bottom, spine would come up here, hips are attached here on either side. Now, we do see some anatomical changes between men and women. Women's pelvises are wider. They're much rounder in shape. Men tend to be longer and a bit narrower in shape. because we have to be able to pass baby. Sorry, guys. All right, so for having a nice healthy spine, we have to have some really good muscle strength going on, some good stability, and good muscle endurance. Included in some of those muscles is our multifidus. I'll show you a picture of that later, but basically they're kind of these anchor points throughout the spine and the back. We'll talk about the rectus abdominis. That's your classic six-pack abs in the front. We'll talk about transverse abdominis, which is the deepest layer of abdominal muscle all the way at the bottom. It goes all the way across your body like so. We'll talk about pelvic floor, which is at the base of the pelvis. And then there are a couple others that I'm not really going to get into too much today, but those include your diaphragm. We will be talking about diaphragm actually later. Latissimus dorsi is in the back here. Lower and middle traps and rhomboids, these attached to your shoulder blades, they also change quite a bit throughout pregnancy and while we're nursing particularly. All right, so I was mentioning multifidus. These are these anchor points. They're very small muscles in the spine. Any kind of tiny movement that you're going to do, those multifidi kick on just a little bit. That rectus abdominis, that's the classic six-pack abs. As we're pregnant, you can imagine that they get more and more stretched out. They actually change position for quite some time. They can even maintain that positional change after pregnancy for a while. We'll talk about that a little bit more later. Deep to that, again, this is the deepest abdominal muscle is your transverse abdominis, and he's one of my favorites to talk about because he tends to give up the ghost during pregnancy. He just says, I'm done, I'm too stretched out, I can't do this job very well anymore. And it's one of the first ones that I start working with patients postpartum to make sure that they get much better core muscle control and support afterwards. All right, and then my passion is pelvic floor. So your pelvic floor is a series of muscles at the base of the pelvis underneath. It's very bowl-shaped. You can see inside here. Its job is to maintain good bowel, bladder, and sexual function. It also helps keep your abdominal organs in place. If you didn't have a pelvic floor, everything would fall to the floor, and that's no good. It's at kind of like some people call it the pelvic diaphragm, mostly because it works in conjunction with your diaphragm up here. As you inhale, your lungs get bigger, your diaphragm descends, your abdominal organs descend, your pelvic floor also gets a little bit longer. When you exhale, conversely, the pelvic floor comes up, abdominal organs come up, and your diaphragm also comes up. So that's kind of this pistoning effect. And we'll be talking about that when we do our lab involving with some breathing techniques. All right, so now that we've had a little look at anatomical structures, we're going to talk a little bit about how these change. For those of you who are quite far along in pregnancy, you're probably experiencing many of those changes and thinking, oh my gosh, is my body ever going to be back to how it was before? And the answer is probably. It does take time, I will say. I noticed for myself personally, so my kid is going to be 1 year old on April 26th. It's been almost a year. And I only started having a hard look at myself a couple weeks ago and noticing that I actually feel like I did pre-pregnancy. And it feels like it took a really long time. Most of my friends who have been pregnant, they say, oh yeah, it took me about a year. And so now I feel like, oh, okay, this was attainable. But immediately postpartum, I thought, oh my gosh, how am I going to get back there again? Some women, they bounce right back. Some women like me, we just take a little bit longer. So just to let you know, there are all these changes that occur, and anything that causes any kind of dysfunction, we certainly can help you out with. So the first thing that happens is relaxin. How many of you have heard of relaxin? Do you guys know what that is? Yeah, many of you do. It's not super great. Some women, this is how they find out that they're first pregnant. When you have been bent over for a little while, you're crouching, and then you go to stand up really quickly, your blood vessels actually can't contract as well as they used to because of relaxin. They're designed to shunt all of this blood straight to baby, and your body actually, over the course of pregnancy, ends up getting about 50% more capacity of blood. It's a lot, all right? And so because of that, when you change positions so quickly, all of that blood just falls straight out of your brain. You have this orthostatic hypotension, a drop in blood pressure immediately, and you feel faint. So this is how some people discover that they're pregnant. Actually, that's how I first decided that I was probably pregnant. So I got off the row machine at the gym, and I stood up, and I'm like, whoa, what happened? So anyway, that was very surprising to me, but not totally unexpected. This hormone is specifically designed to allow more laxity within the ligaments so that when you get closer to giving birth to your baby, your pelvis has made some massive shifts in order to pass the baby through between the pelvic bones. As a result, this can happen. Our muscles tend to tighten right around those joints a lot more than they would otherwise because they're just trying to keep you together. And that's where some of our pain can happen. If we have pain during pregnancy, not everybody does, which is totally fabulous. After relaxin, another major thing that happens during the first trimester is morning sickness. Not everybody develops morning sickness. Some people only have it during their first trimester. Some people have it throughout the duration of their pregnancy. Every single pregnancy is different. So if this is your first, your second one, if you're planning on having a second one, might be entirely different from this one. If you've experienced a ton of morning sickness this time around, it doesn't mean that next time around you will. There's some very loose research showing that if you're pregnant with a girl, you tend to have more morning sickness, but that's not a cold hard fact or anything like that. Some people find that diet modification helps a lot. I know when I was pregnant, I just had to keep eating. As long as I ate, I felt awesome. If I decided that I was only going to have my 3 square meals a day, I felt terrible. And so some people find that that really works. Some people find it doesn't work at all. So do a little experimenting and see what works for you if you're experiencing any morning sickness. Blood pressure typically remains the same during that first trimester, except like I said, when you go from sitting to standing too quickly or crouching to standing too quickly, you can have a sudden drop in blood pressure, but we tend not to see an increase in blood pressure. However, you probably noticed every time you go to the OB-GYN, they're taking your blood pressure like the first thing when you walk in the door. They want to make sure that you don't have any significantly elevated blood pressure because they're looking for a lot of other precursors for potential complications during your pregnancy. Your heart rate will increase at rest. Like I said, your blood volume increases by 50%. That's really, really high. And the body is designed to accommodate for all of this, but this is also why you might be experiencing some fatigue during the first trimester, okay? It's really hard to exercise during the first trimester for some women, not everybody. I found it was really hard. If I went for a run in the morning, it was like I couldn't do anything else for the rest of the day. And some women can just exercise throughout each trimester of their pregnancy, no problem at all. But listen to your body and see what your body tells you. And of course, listen to your OB, like I said at the beginning. If your OB has given you any contraindication for exercise, please listen to what your OB has to say. However, if your OB has cleared you for exercise, by all means, if you feel like you're able to do it, keep doing it. Second trimester, most women start to feel awesome by this time. It's like all of a sudden you wake up one morning and you're not sick anymore and your fatigue is gone and you feel like you can actually do work. It's pretty awesome. This is the time when if you've had to take a break from exercise because of any major fatigue or morning sickness during first trimester, this is when you really want to get back to it to make sure that you're able to maintain your fitness level as best as possible. You are going to gain weight. That's normal. That's expected. I think what ACOG is saying now is that the normal pregnancy weight gain is about 30 pounds. This also depends on what your weight was prior to pregnancy. But certainly you should be gaining weight. That baby's got to grow, right? Your center of gravity is going to shift forward, increasing lordosis. Now, lordosis, I'll show you a picture of this later, but basically what that means is the curvature in your low back. As your center of gravity goes forward, that curvature tends to increase, and that can cause some pressure and discomfort in the low back. Okay. So we'll talk more about that later. Third trimester, of course, baby's getting bigger. Baby's showing up more on ultrasounds. It's very, very exciting. We're working really hard to get that crib together and everything at home. You might even find that you go through some nesting stuff. I planted a massive garden at my house. It was ridiculous. With these postural changes, you're going to find that some things are a little bit challenging. I mentioned before putting on shoes. In my 3rd trimester, I couldn't put on shoes. Every morning, my husband had to come and put my shoes on me. And there was one morning where I just sat there crying because I thought, oh my gosh, I should be able to do this on my own, but I cannot reach my feet. And any of my colleagues who saw me pregnant, I wasn't even that big. But you can't really just bend over that baby. This is solid. It's in the way, right? Things get a little challenging when finding a good position in bed. That's something that we're going to talk about, and I'll show you some demos later as well, some things that you can do to hopefully feel a little bit more comfortable in bed. Even just rolling around in bed can be really challenging. If you haven't noticed already, you're going to have an increase in breast size. That can be a little bit challenging and uncomfortable. Do make sure that you're wearing a good fitting bra. If you find that you're outgrowing your bra, please go to the store and get a new one. You're going to feel so much better. You might have some more fatigue. At this point, you've had increased weight gain. I remember I couldn't walk around my house barefoot anymore. It was very uncomfortable. I had to have little slippers on my feet just because of that increased weight gain. Often people experience decreased sleep during this time. I did not. I was sleeping pretty darn well, but everybody's totally different. Just because of all of the postural changes and the difficulty rolling around in bed, some people find it's a lot more challenging to sleep. And of course, if your partner is sleeping right next to you, they're staying awake just as much as you are with all the rolling around. There are also a lot of other stresses involved. Everything that you are trying to think of to get ready for this baby, I'll tell you at the end of the day, nobody's ready. You're only as ready as you possibly can be, and then nature will take its course and you'll figure it all out in the end. 3rd trimester is often when this water retention happens. For any of you in 3rd trimester, have you experienced any of that? Any swelling in the feet or hands or anything? No, not too much. I had a little bit. It wasn't too bad, but I certainly had patients who have had, as Lee was talking about, his wife had experienced a lot of carpal tunnel syndrome, and that's often from that water retention because you get pretty swollen around the wrists and hands too. How many of you have heard of diastasis rectus abdominis? Some of you know what that is? Yeah. So I showed you a picture of your rectus abdominis muscles, that classic 6-pack abs. I mentioned how during pregnancy they stretch and they change positioning. That's during pregnancy. It is normal to develop a diastasis recti. That's when we have this stretching within the rectus abdominis, okay? After pregnancy, it feels like there's a cave in here, okay? What's not normal is for it to last well beyond pregnancy. I have met a few women who, like, immediately postpartum, they had no diastasis at all. I was not one of them. I did. It was actually really frustrating to me because as a physical therapist who treats diastasis, I'm like, why do I have this? But it happens, you know, it can happen to the best of us. And the research about it is still relatively new. And so we are starting to determine that there might be some genetic factors for women who develop it and it stays. We're also starting to see that there are tons and tons of mechanical things that we can do, and the abdominal exercise that I'm going to be teaching you guys tonight is one that you can be doing throughout your pregnancy and beyond to help with any potential diastasis that you might have. Because of that shift in abdominal muscles, this can cause weakness not just in the abdominals but also in the pelvic floor. Your abdominal muscles and your pelvic floor are very, very closely related. They live right next door to each other. They are very best friends. If one of them isn't working right, chances are the other one isn't either. So that's where we can start seeing some pelvic floor dysfunction, some urinary leakage, incontinence, maybe some constipation, stuff like that. During your 3rd trimester also, you have this massive shift in your rib cage upwards. And this can also cause increased pressure down into the pelvic floor. This is where that difficulty in breathing can come in. Like I was saying, just sitting in my car, that was like too much for me to be able to breathe right. I felt like I constantly had to extend to get my lungs bigger. All right, and postpartum changes. The uterus has to return to its normal size somehow. Just like with so many things with the uterus, it cramps. It's not really fun. I believe one of the hormones that contributes to this cramping is oxytocin, which your body releases when you're nursing. So many women, while they're nursing for the first, even up to a week postpartum, will feel a lot of abdominal cramping each time they nurse. This is something that one of my friends told me, but I don't think any of my OB-GYNs ever told me this. So I like to arm you with that knowledge, that if you experience abdominal cramping postpartum, it's probably that the uterus is returning to its normal size. All of your labor and delivery and mommy care nurses afterwards will be coaching you through that as well if you need it. Your body temperature and blood volume reduces. You sort of start to feel like a more normal human being again. Often there is pelvic floor muscle weakness. These muscles have been stretched during pregnancy. Incontinence is not uncommon. Even if you immediately postpartum haven't experienced any kind of incontinence, say your OB-GYN clears you to go back to the gym at that 6-week postpartum checkup visit that you're going to be having, often second you get back into the gym, you take one jump and that's it. It's not, like I said, it's not uncommon at all. If it lasts beyond that 6 weeks, even up to 3 months postpartum, please come and give us a call. We would love to treat you for that because it is frustrating. At that point, it's not really considered to be normal anymore. All right, and then, of course, your postural changes start to occur a little bit backwards because now we don't have this baby in the way. We can start being a little bit more upright. We can breathe a little bit happier. We can see our feet again. We can walk barefoot. It's glorious. All right, so this is kind of the meat and potatoes of this whole lecture. Postural tips, and we're also going to talk about a lot of biomechanical things that you can do to save your body throughout pregnancy and beyond. And this is also, the next section about all the mechanical stuff is also for guys because you're going to be lifting a lot of baby equipment. You're going to be lifting baby a ton as well. Okay. All right, so some postural extremes that are really, really common during pregnancy. I mentioned that excessive lordosis, and that's that rounding or that arching of the back right here just because your center of gravity is going forward. How many of you guys have heard of hip flexors? Do you know what those are? A lot of people here, yeah. So the hip flexors is a group of muscles in the front right here. Some of them attach starting up here and then they go down to here. If you can envision, if we have point A and point B, and then my center of gravity gets bigger here because I've got a baby on the way, I start to arch my back a little bit more to accommodate for that center of gravity change. You can envision how these 2 points get closer together, okay? That becomes almost chronic. So we have these now shortened hip flexors that aren't allowing you to get the leg behind you enough, even when you're doing things like walking, okay? That can tug on your spine a little bit more. It kind of creates this little cycle going on that can be uncomfortable on the spine. I also mentioned the abdominal stretching already as well, and that just is a natural part of pregnancy. Something else that can happen is as that back starts to arch, one way that we try and accommodate for that shift in gravity is we start to just lock out our knees like crazy. So that's what this knees hyperextended posture is talking about. So some people even have discomfort in the knees because of that as well. So what we really want is a neutral spine. This is easier said than done just because baby's in the way. But if we can create nice teamwork, that means that all of our muscles that are surrounding our core muscle system or are part of our core muscle system, such as our abdominals, some of those back muscles that we mentioned earlier, our glutes, all these guys back here, if they're all working together nicely, then we should be able to bring ourselves back to a more neutral spine, offloading some of that pressure in the back. This allows for better balance going on so that we don't have that increased pressure. All right, so body mechanics. As I said, this applies to guys too because you're going to be lifting a lot of baby equipment. Couple of things to keep in mind when we're sitting, whether it's on a chair or a couch, try and avoid slouching. Nice. Especially as you get farther along in pregnancy or once you give birth and you're still nursing. While you're nursing, that relaxin is still in your system. So if you're slouching and you're hanging on those already loose ligaments, your muscles aren't supporting you anymore, and then you can start to have some pain in the shoulders, in the neck, in the back, in the hips, etc. Try to keep your pelvis level, so try not to have like one hip up on something or like legs crossed or any of that stuff. As you know, in third trimester, it's like impossible to cross your legs anyway, so don't really have to worry about that. Keeping your feet flat on the floor can be really helpful. Use those legs to get up and down. Try not to like push up like this. This is as pregnant women, this is always what we want to do when we go to standing. So part of the reason why we're going to be talking about like some squatting and sit to stand techniques today is to make sure that you feel really confident when you're getting in and out of chairs. Some women find that having the knees level or slightly higher than the hips feels pretty nice. That's largely because when we're pregnant, we have that lordosis going on. The pelvis is kind of shifted forward like so. And so if we get our knees up a little bit higher, then we can get the pelvis back into a more neutral position. Some people also find that sitting on small towels wedged underneath those sits bones kind of helps relieve some pressure into the tailbone if you have any of that discomfort in the pelvic floor. All right, so this is our default, right? This is not where we want to be. This is more where we want to be. She has a book underneath her feet. This is actually the setup that I have at my desk. Her knees are a little bit higher than her hips. Her elbows, if you guys are, there's so many people in tech here, and I think everybody works on a computer anyway. So you want to have your elbows at about 90 degrees. The only thing that I would probably change about this setup is that I'd like her not to be at a laptop. It would be better if she had a monitor that was a little bit higher. All right, we're going to talk more about getting up out of a chair later because we're going to practice that. But you're going to be getting up and down a whole lot, okay? So the best way to do it is instead of rounding at the back to stand up, you're going to hinge forward and then go to stand up. In fact, can I have my demo, please? And we need a chair. Tori is going to be our demo today. We can put it right there. I think we'll have enough space. All right, go ahead and have a seat, Tori. Lovely. Okay, so the best way to be getting up out of a chair is we're going to hinge forward at the hips, keeping the back nice and straight. You might want to have your feet a little bit farther apart, not away from the chair, just farther apart. In fact, you probably want them under you a little bit more. Yeah. So then we're shifting our center of gravity forward. You're going to power up through those glutes and heels into standing. Okay. So go ahead and sit back down. The way you don't want to do it is by rounding the back and then pushing up. Yeah. So if we're rounding the back and pushing up, we're putting a lot of load through those wrists that might already be a little bit tender in that third trimester. We're also not powering from our glutes anymore. We're powering from our back instead, and these muscles aren't really designed to do that. So if we hinge forward and then we go to stand up, we're going to feel an awful lot better. Okay? You can hang out here because I'm going to use you some more. Thank you. Okay, hip hinging. Actually, Tori, you can demo this for me too. So in order to be lifting anything up, we are going to be practicing a little bit of a squat today, but the root of the squat is this hip hinging. You bend forward at the hips while making sure that that back stays nice and straight. So Tori, if you could turn sideways for me. Good. So keep the back nice and straight. Go ahead and hinge forward at the hips, almost as if you're giving a bow. Lovely. And come back up. Great. So we don't want to come too far forward. At that point, you're going to want to start bending your knees, and then you can hinge at the hips a little bit more to get lower. Okay. We really want to maintain some good symmetrical weight bearing. If you are spending an awful lot of time like shifted onto one hip or not, you can have a seat, Tori. Thanks. What's that? Yeah. Because our pelvis is so unstable during pregnancy, if we spend too much time hanging out on one leg, then that pelvis can really start to shift a little more in one position than we want it to, okay? So making sure that we've got equal weight distribution, and this also goes for while we're walking. If we don't have this little side-to-side swagger, we're going to feel a lot better if we stay as neutral as possible. Okay, go ahead and come on over here, Tori. Thanks. How many of you find getting in and out of bed to be totally awful at this point? Yeah, it's terrible. You do too. Yeah, me too. This morning, man. Oh, man. Mondays are hard. Thanks, Theo. If you can. You're clicking. You're messing me up, man. Right there. Cool. Thanks. That's perfect. Okay, so Tori, show me how you get, if this were your bed, show me how you get in. Just be lazy about it. Oh, well, then she does a log roll. Yeah. So if you were lazy and you didn't know anything about physical therapy, how would you get out of bed? Yeah. All right. So how hard did that look? Was that kind of awful? All right. So now, go ahead and stand up for me, Tori. Thanks. So now I'm going to show you, via Tori, how to get into bed without having quite as much discomfort. All right. So first, have a seat right here. We call this a log roll technique because logs do not twist or bend. Tori's back is not going to twist or bend as she gets into bed. Okay, so scooch back a little. There you go. Good. I know, it is really tall. Okay, so she's going to come down onto her side first. Lovely. As she comes down onto her side, you saw that she picked up her legs with her. That's kind of a counterweight. Okay. If she wants to be on her back, then she can just roll as one unit, so torso and legs together onto her back. Yay! Good job. In order to get out of bed, then you do the opposite. You roll onto your side. Good. Bring the legs forward. Good. And then come on up to sitting. Now, throughout pregnancy, some of you may find that you can no longer be on your back. We do not have any specific rules for you being on your back or not anymore. OB-GYNs have said that the research shows that it doesn't matter as long as you feel okay being on your back, and if you don't feel okay being on your back, you know it. It's very uncomfortable. Some women get very short of breath. They start to get lightheaded, things like that. But I certainly have treated my fair share of pregnant patients well into their third trimester who can still be on their back. Okay, so that's all up to you. All right, now we're going to talk about some cushy pillow techniques, all right? Because being in bed when we're pregnant is super uncomfortable. Just about anything we do being pregnant is super uncomfortable. So we're going to imagine that Tori is super pregnant. Woohoo! Go ahead and lie down onto your side for me, Tori. Most women find that being on their side is the most comfortable thing for their backs and everything. And guys, if you've been doing a ton of lifting and you notice that your back is starting to take its toll, sleeping this way is not a bad idea for you either. So the first thing that we're going to do is we're going to put a pillow between Tori's legs. There you go. Right there. Okay. This helps keep her spine in a little bit more neutrality instead of hanging out to one side in this weird curved pattern. I had like 2 or 3 pillows that I kept. Some women think that this feels a-okay. Tori, go ahead and straighten your bottom leg for me, please. There we go. And then bring it behind you a little bit. A little bit more. There we go. Good job. Some women find that actually just piling up pillows under one leg and keeping the other leg totally straight feels pretty good. Sort of on the edge of the table. How's that? Is that better? Okay, good, great. In this way, she's still not twisted at all. And because we can't be on our belly anymore, some women find that this is a nice little substitute. What else have I got here? Also, throughout pregnancy, our hips get way wider than they would otherwise, which means that we start to develop a lot of space on either side. One way that we can accommodate for that space is just a hand towel. I used some simple scarves. I'm going to slip this underneath your waist, Tori. There we go. So this just goes right underneath her waist right here, and that helps keep that spine in better alignment too. As we get farther along in pregnancy and baby gets bigger and belly gets bigger, that belly's going to start tugging you to one side. So if you can imagine Tori with a nice big pregnant belly, she's going to be tugged to the side a little bit. This can be really uncomfortable on the spine. And so some people find that having another folded up towel wedged underneath the belly feels really, really good. Also, I kind of mentioned a little bit about how our shoulders can make some postural changes as well. This is one way that this can happen. When we're on our side and we have all this ligamentous laxity because of relaxin in our system, our shoulders can kind of collapse in on each other, and that starts to get uncomfortable too. So we have yet another pillow. Ready? How's that? Is that good? All right, great. And then, just for added support, some people find that having another one in the back feels really nice as well. That too. Sometimes hubby doesn't like to be that close to a furnace, though. So, these are a couple of different pillow techniques that you can use to hopefully make your bedtime situation a lot happier. Now, the only caveat with this is if you have to roll over, guess what all has to come with you? All your pillows. Anyway, do you feel super comfy now? I do. You look like you're super comfy. All right, cool. All right, so we had mentioned this, we call it the 3/4 prone, is when she's got her leg over some pillows here. I would almost put another pillow underneath here, but I'm out of pillows now. Just to keep this leg a little bit higher. But that tends to feel really, really comfortable. I loved this position when I was pregnant. Okay, thank you. I think I'm done with you for now. If I need you again, I'll let you know. All right, car. How many of you hate getting in and out of your car now? Yeah, it's terrible. Do most of you have SUVs, or do we have sedans in here? No, we've got some sedans going on. All right. It's challenging. Our fastest way to get in and out of the car is, of course, to like twist and get in, right? Our bodies don't really like that when we're pregnant. So one thing that you can do is adjust those mirrors while you have good posture sitting in the car. If you have to, take some towels and get them behind your back in order to add any kind of support that you might need. We talked earlier about creating a little towel roll. You can do that with a hand towel to put underneath your sits bones if you feel like you need something under there as well to offload your tailbone a little bit more. This trick about adjusting the mirrors while you're in really good posture is really cool, because that means that as you're driving, if you start to notice that you can't see out of your mirrors, it probably means that your posture has deteriorated. So it's a nice little reminder to get you back upright a little bit more. That whole twisting thing that we do to get in and out of the car is very aggravating on the spine. So you can do a couple of other things instead. Avoid that twisting. You want to open your car door, sit down, turn your entire body in. Easier said than done, especially when we have a nice big pregnant belly in front of us. And that should be the way that you get out of the car too. So once you're getting out of the car, push the door open, your entire body turns as one, and then you go sit to stand. Okay, so in that way, we're not doing any twisting at all. Does that make sense? Okay. If I had a model of a car here, it would be so much easier, but I don't. Sorry. So this is what you want to avoid, this twisting that we all tend to do. The best way, so in this picture, she's first sitting straight, then her entire body is turning, and then she is standing out of the car. Of course, this is easier for her because she has a higher car. If you drive a sedan, that can be a little bit more challenging. That will mean that you have to hinge forward at the hips a little bit more so you don't whack your head on the car door. All right, baby carriers. How many of you have your baby carriers yet? Baby carriers, car seats, you've got them? Okay, this is mine. This is one of my favorite demos. I actually saw a video of this. One of my friends sent it to me. Some other pregnant PT had posted this video of how to carry a car seat without killing yourself, because these things are awful. If you carry it like this, this gets really tiring after a while. Carrying it like this also gets really tiring after a while. And you see, in order to keep this upright, I kind of have to cock my body to the side a little bit. This is very uncomfortable. So this is what I learned, and I love it. To start off, have baby facing away from you. Take whatever arm you're going to use, hook it around, grab the knob right here, get it on your hip, and that's it. I can't use this left hand, of course, but it's holding the baby, all right? But I can do anything else that I want to with righty here, okay? And of course, you can do the other side too, whichever side you'd like. Getting the car seat out of the car this way is challenging. So I recommend if this is your car, I've opened the door. I want to get this car seat out. Hinge at the hips, just like we were talking about. Grab the button, lift until it's on the car seat, depending on how you have the car seat situated in your car. All the research shows that the safest place to have this car seat is in the center in the back. That is not always practical, especially if you're driving a sedan. If you're driving an SUV, it's a little easier because you can kind of stand into the car and do it and then get it down onto the car seat off of the base. Otherwise, have it in the sidemost seat in the back, okay? Because in that way, it's right next to you. And anything that's close to your body is going to be easier to lift. Does that make sense? Okay, good. You can kind of, depending on the height of your car, you can start off with this technique. Release, lift, go. Okay? Sometimes they get a little bit stuck, so you have to finagle with that release button, but loading the stroller in and out of the car. We've talked so much about how you don't want to use your back, you don't want to round your back to be lifting stuff. So this is another demonstration of how this is really poor posture, getting this stroller in and out of the car. He's got his back totally rounded. Now he's lifting with his hips, and now he has his back totally arched, and he's trying to like haul the stroller into the car with his hips, and that's going to drive him crazy pretty quickly. So in these pictures, he has a nice wide stance. The back is straight. He's hinging at the hips very nicely, just like we talked about. No twisting involved. Every time he's turning towards the car, he's using his legs, not his back, to twist. This is a very light stroller. Most strollers are not that small and light. Same business with some of your household tasks, such as loading the washing machine. Having the split stance with the back totally straight is much nicer than having the back rounded like so. Same thing with doing the dishes. If you have a nice split stance here, you can even have one leg kicked out behind you to act as a counterweight, okay, in order to get dishes in and out instead of rounding at the back. I know a lot of dishes are going to go by the wayside as soon as baby's born. Hopefully you have lots of friends who are going to be coming over to help you out with that, because I don't remember having done a single dish like several weeks after pregnancy. If you get to vacuuming at all, the same rules apply, all right? You want to make sure that that vacuum is pretty close to your body. Have a good split stance here. Have the back totally straight. I think the only thing that I would change about this is her vacuum is pretty far away. If you let the vacuum get too far away from you, then you're going to end up having to twist in order to get it back again. So keep it close by. Use your legs to move in and out. Okay? It's a lot nicer. Holding baby. You're going to be doing an awful lot of this. Some babies hate to be put down. My child was like that unless he was sleeping. So here's our demo baby. Instead of keeping baby right here at the hip like so, because this gets really tiring after a while, my back is not straight anymore. It's jutting out to the side. This is going to be really awful for me after a while. You want to keep baby as central as possible, okay? Depending on, you know, the size of your baby and stuff like that, you might be able to go one-handed. I do recommend that you try and alternate sides that baby is going to be on. Some babies really like to be carried like this. This actually feels pretty good if you're a mama. Babies really like it too. Sometimes they like it more like this. There are all sorts of positions that you can get baby into that are more comfortable for you. No matter what, if you keep baby pretty central instead of off to the side or anything, you're going to feel quite a bit better. Okay? You're going to be doing a ton of nursing. Guys too, you're going to be probably bottle feeding baby, obviously, instead of nursing, but some babies don't take a bottle. So anyway, that's why I mentioned that. It's really, really tempting to nurse baby in bed. I highly recommend that you don't do it because it's very difficult to get into a good posture that's not going to be aggravating for your back and your neck and your spine. In this picture, she's very, very hunched over. It doesn't matter if she's bottle feeding baby or if she's nursing baby. Without good support, we end up rounding a lot like this, and it's very common to have some neck, shoulder, even wrist pain because of this. So there is a plethora of nursing pillows out there. Find something that works well for you. I had a boppy. I personally didn't like it, but I also have a really long waist, and so what worked best for me was just a really fat throw pillow that was probably about this big. I have a nursing chair like this at home. I really, really enjoyed it. Some people do fine with just like an accent chair. If you have any kind of other rocking chair, it feels really good. If you haven't already decided to see a lactation consultant, I highly recommend it, even if you have no problems with latching. Sometimes there are certain little things that crop up down the line that you don't even know that baby's having a hard time with, or you don't know that you're having a hard time with. And a lactation consultant can give you a ton of information about really good positioning for nursing, things that will benefit you and baby the best in the long run. Nursing can be really, really frustrating. Some women never accomplish nursing. It's kind of in our culture these days to say that, you know, you should be nursing your baby, breast is best and all that stuff, but at the end of the day, baby has to get fed. So if something happens and you don't produce milk well, or baby doesn't latch well, whatever, as long as baby is fed, at the end of the day, that's the most important thing, okay? But if you are nursing, take some precautions in your postures. Make sure that you have good pillow support under that baby. You don't want to be holding baby and using muscles to keep baby at the boob or keep baby cradled up to you if you're giving baby a bottle. This gets very tiring very quickly, even if your baby is only 8 pounds. Okay? Baby's not going to stay 8 pounds for very long. It's going to get way big really fast. So getting that pillow support underneath there is going to save your shoulders and your neck and your back. When baby's super little, you probably won't find yourself putting baby on the floor, but you might. So when you're getting down onto the floor to pick up baby, same rules apply. Try not to round that back. Make sure that your back stays nice and straight. You can do this split kneeling stance that this person has going on here. That works really, really nicely. If you're just grabbing baby really quick and you've got some good powerful legs, you can just do a squat to pick up baby. All right, 2 from the crib. This can be really, really challenging. In the get-go, baby, depending on your situation, you might not have baby in the crib right away. You might have bassinet or something else like that. But once baby is in the crib, it can be really hard to get over that railing to get in. We don't have drop-down cribs anymore. If you're going to buy a used crib, make sure that it does not have a drop-down railing. Okay, those are not pediatrician approved anymore. So here she's rounding her back to get into there to get baby. The second picture that we used to have was a drop-down crib, so I replaced it with one of my own. I put a step that actually we have right here in order to get into the crib more nicely if I can't reach over the side to get baby out. Okay, a step can really help. Then you're able to get that good straight back. You're able to use those glutes and legs in order to pick up baby. Same thing with getting into and out of a high chair. As baby gets a bit bigger, you still want to, no matter what, when you're lifting baby, keep the back nice and straight. Use those glutes, hinge at the hips. All right, bathing. This can get really, really tricky. For as long as you possibly can, bathing in the sink is awesome. My kid is almost a year old and he's still being bathed in the kitchen sink. And I want to keep him there as long as possible because being on the floor like this for however long that they are playing in the water sounds terrible. But we'll eventually have to get there. So here you can see she's rounding her back. You know, same thing over and over again. Here she has a split stance. Here she's just kneeling over. You might want to get some kind of kneeling pad specific for being next to your bathtub. Some people find that if you take a really short stool, I mean, we're talking no taller than this, putting it into the bathtub and then you're in the bath with the baby, you can hinge at the hips really nicely. You get a nice wide leg position and then you can hinge forward and play with your kid, and then you're playing with all sorts of bath toys too. You're having a good time. All right, Any questions so far? No. Does anybody have to take a pee break? Yes. Okay. Bathrooms are back there to the left. Why don't we all just stand up and stretch a little bit? We are almost done. Yeah. Okay, good. Great. All right, so we're going to talk a little bit about exercise pre and postpartum. Again, with physical therapy, we like to prescribe exercise on a very individual basis. And so the exercise that we're going to talk about here is really, really general. It's some general guidelines to make sure that whatever exercise you're doing prior to pregnancy and throughout the beginning of pregnancy, that you can maintain throughout your pregnancy as long as your doctor says that it's okay. Benefits of exercise. I think for some of you, I will be preaching to the choir when I talk about this. But anyway, exercise, of course, even if you're not pregnant, helps improve your sleep. So guys, because you're probably going to be losing a lot of sleep after baby is born as well, I highly recommend that you do everything that you can to maintain really, really good sleep while your wives or significant others are pregnant at this time. So exercise is one means of doing that. It can also really help prevent that low back pain, because if you're exercising and you're using those poor stretched out abdominal muscles, they still are supporting you better than if they were weak, right? They will get weak throughout pregnancy. That's kind of a natural, that's par for the course. However, we still can keep them active and they still can support that back throughout pregnancy. Making sure that you're exercising well helps you maintain that good posture and keep it helps keep that muscle tone going, strength and endurance. All of that stuff actually is going to benefit you once you get to the end of that tunnel and the baby's born. Because the stronger you are, the more fit you are, the more fitness you maintain throughout pregnancy, the relatively speaking easier your labor and delivery is going to be. That's what the research shows. Now, if you have a baby that has a bowling ball sized head, that is a different story, as one of our friends can attest to. Also, exercise helps reduce that risk of gestational diabetes. Diet is another means to reduce your risk. If you haven't already discussed this with your OB-GYN, make sure that you do so. It also helps maintain lower liquid retention. Some people find that the more you exercise at the end of pregnancy, the more retention you end up having, but many, many people find that the opposite is true, that the more you exercise throughout and towards the end of pregnancy, the less fluid retention you have, the more comfortable you are. Okay. And again, it helps control that gestational weight gain. I mentioned earlier that the current standard for weight gain throughout pregnancy is about 30 pounds. That is different depending on what your weight was prior to pregnancy. Okay, so ACOG, they are the gods and goddesses of everything and all things pregnant. Recommend 30 minutes of mild to moderate exercise at least 3 times per week. Again, there's a giant asterisk there. If your OB has not cleared you for exercise during pregnancy, definitely follow all of your OB's advice, okay? When should you stop exercising? Vaginal bleeding, just stop. Shortness of breath prior to exertion. As you know, when you're going to be exerting, especially when your baby is very, very large inside of your belly, breathing becomes harder and harder. Okay, so having some shortness of breath during exercise is expected and normal, but prior to exercise is not. Any dizziness, headache, chest pain, preterm labor, this is challenging because if you've never had a baby before, you don't really know what labor feels like. Most people will experience Braxton Hicks at some point during their pregnancy. How many of you know what that is? Most peeps. Okay, cool, great. Some people describe Braxton Hicks contractions as like this sudden tightening going on down here. This is your body getting ready to actually go into labor and have a baby. Some people experience Braxton Hicks as early as 17 to 20 weeks pregnant. That's really, really early. That's just your body getting ready for it. So this whole preterm labor business, make sure that like the contractions for preterm labor would be very, very intense, not just this tightening experience, okay? If you experience decreased fetal movement, definitely talk to your OB about it. If you've been exercising and then afterwards for the whole rest of the day you don't feel anything from baby, I would give your OB a call just to make sure everything's okay. However, I will tell you that my kid would sleep better during the day while I was pregnant if I exercised. So he was a little less active if I exercised. When I didn't exercise, he seemed to be a little more active. If you have any amniotic fluid leakage, consult your OB before doing any kind of exercise. It used to be the gold standard that if you had amniotic fluid leakage, then they would want you on bed rest for the duration of pregnancy. I think those standards are starting to change. Don't quote me on that. If you have any calf pain or swelling, definitely stop exercising. And if you have any sudden muscle weakness, stop exercising as well and talk to your doctor. Okay, a couple of pregnancy tips. Exercise, including pelvic floor contractions. We are going to discuss pelvic floor contractions and do a little bit of very generalized practicing of this today. You want to maintain a good, healthy pelvic floor throughout pregnancy. It is going to get stretched out just like your abdominal muscles do, but if you can really grab that pelvic floor and do a good contraction, then you know you're on the right track. It is also equally, if not more so, important to have good, full pelvic floor muscle relaxation after that contraction. How many of you know what a Kegel is? Lots of people. Lovely. Again, we're going to be sort of practicing this in lab. For anybody who is experiencing any pelvic floor dysfunction right now, it is contraindicated for a pelvic floor physical therapist to do an internal vaginal assessment to make sure that your muscles are working okay. I don't have a good reason for that. I have asked instructors the planet over about why we can't do that, and they don't have a good reason because I think there's not enough research to show that it's okay. That being said, I'll still describe to you how to do a pelvic floor contraction today because it will give you some good idea of what you should be practicing at home. Again, after the contraction, you want to have good, full relaxation to maintain good muscle length in the pelvic floor. Okay, so we'll talk about that a little bit more later. Stay hydrated, just like when you're not pregnant. While you're pregnant, you need a ton of water. You have a whole lot of blood. You got to maintain it. Drink a lot of water. It's good for you. Wear appropriate shoes and sports bra. If your sports bras are getting too tight, go to the store and get some bigger ones. If you do some high impact stuff, like I was running through, I think up until week 26 was when I stopped. And before then I had to get sports bras that were the largest high impact sports bras that any place had to sell. And that's a little challenging to find, but make sure that they fit really well.
Do you have a recommendation?
Yes.
For where
to go?
Yeah.
Oh gosh, let's see. I'm cheap. I went to Old Navy.
but they work for you.
Yeah, but I found stuff that worked for me, and some of them I'm still wearing today, and so I really, really like them. Yeah. But any place that you go to that, if you're doing high impact sports, make sure that the sports bra says that it is good for high impact. Okay. Otherwise, you're not going to be happy. If you just need a sports bra because you're going for, you're doing some regular walking, some lifting, stuff like that, you probably don't need the high impact ones, and they're a little bit easier to find in larger sizes. Okay. For shoes, I don't have good recommendations for shoes because everybody's feet are entirely different, but make sure you have supported shoes, okay? If you work a job where you're standing a lot, I don't recommend just having like little ballet slipper flats, okay? Have something more like tennis shoes that have good inserts, all right? Avoid excessive weightlifting and being on your feet for too long. Of course, gravity takes its toll and that fluid likes to go down. So you'll feel a little bit more comfortable if you take breaks from standing regularly. As we talked about, avoid extreme asymmetrical patterns. How many of you guys have done any yoga? Yeah. Do you guys know what pigeon pose is? Yeah. Don't do it while you're pregnant. Okay. Rather, I recommend that you don't do it while you're pregnant. The reason why is that it's a great stretch for hip flexors. It gets these guys a lot longer. However, it does put a lot of torsion into that pelvis that's already a little bit uncomfortable. Okay. If you feel great doing it, do it. If you notice afterwards that you feel terrible, don't do it. Okay. Avoid exercising in hot temperatures. We should kind of avoid this anyway, but especially while you're pregnant, you're just a furnace. So you won't feel any better if you're in a lot of heat. And then sleep while you can, because after baby's born, sleep is going to be a thing of the past, but it's just temporary, I promise. Postpartum tips. This first bullet point is the best, all right? So rest when you can and when it's needed, because it will be, and definitely ask for help. You will find that people come out of the woodwork wanting to help you. And there's something ingrained in us that tells us that we don't want to accept that for whatever reason, because we want to be all-powerful, mighty people, new parents. We've got this. But it takes a community, right? It takes a village in order to make sure that baby's nice and happy and healthy. And part of baby being nice and happy and healthy is making sure that you are nice and happy and healthy. So if anybody ever offers you any help of any kind, take it, all right? Even if it's just somebody coming over so that you can go take a shower while baby's being watched. It makes all the difference in the world. Pelvic floor strengthening and core setting as appropriate. So once your OB clears you for some of this stuff, go at it, okay? Make sure those abs are starting to get a little bit stronger. Make sure that pelvic floor is getting nicely engaged. And that pelvic floor you can start working immediately postpartum unless your OB says otherwise, okay? Even if you have a perineal tear, all right? I highly, highly, highly recommend getting those muscles going. They will feel so much better. You will be way less afraid to sit on a toilet after you give birth if you start getting those pelvic floor muscles going right away, okay? Return to exercise with walking program first. This is just to help build you back up to where you were before, okay? Keep those good posture mechanics. Keep that neutral spine, no rounding of the back when you're picking up baby. Keep your shoulder blades back and down with feeding and when you're carrying baby. So again, none of this when you're holding baby. Make sure you're nice and upright when you're holding baby, okay? Make sure you've got good pillow support again while you're nursing, or if you're feeding baby with the bottle. Use your legs when you're going to lift, okay? If incontinence persists past 6 weeks, seek help. Give us a call. I would love to see you. If abdominal separation, that diastasis recti, is present past about 6 weeks, definitely come and see me. I would love to help you. If you have a C-section and the incision is sensitive or painful, come to see me. I would love to help you. If you have, this is not up here, I need to add it to this list. If you have clogged milk ducts, have you guys heard of clogged milk ducts? So yeah, it's not fun. It's really uncomfortable. Fatty deposits can develop in the duct in the breast. The breast often ends up producing less milk. It's very painful. Sometimes it's accompanied by mastitis, which is an infection. Okay, if you have that, talk to your doctor and come and see me. I would love to help you because I can. I treat that too. So this is kind of a nice little segue into how Breakthrough can help you through anything throughout your pregnancy and postpartum needs. Prenatal care. So we have physical therapists, not just me, on staff, who can perform an evaluation and treat all sorts of very common pregnancy-related discomforts, such as that low back pain, some abdominal discomfort, carpal tunnel, shoulder pain, stuff like that. Some manual therapy includes some massage for that back pain. We don't tend to do any joint-type mobilizations just because of that relaxin going on. I really like to educate a lot of my pregnant ladies on different labor and delivery positions that you can have that are a little bit more comfortable. Hospitals also tend to have classes like this as well, where they really go into depth about the types of positions that you can be in. But I think the more knowledge that you are armed with when you go into this, the more comfortable you'll feel. So I also like to teach people a lot about how you can get the perineum, so that's part of the pelvic floor. It's actually this part of the pelvic floor. If this is the vaginal opening, it's right here. How to prep the perineum a little bit in order to stretch more to accommodate the size of the baby passing through. I certainly can talk to you about pelvic floor and abdominal strengthening throughout pregnancy. Many of our PTs can do the abdominal strengthening and some pelvic floor stuff as well. And then guidance of exercise. So currently ACOG says that any exercise that you were doing prior to pregnancy, as long as you don't have any of those contraindications for exercise that we mentioned in that previous list, you can keep doing the same exercise. They don't recommend picking up any kind of new exercise. So if you were not a runner before you got pregnant, do not become a runner while you're pregnant. Okay, that's not the time. Once you're postpartum and you're feeling a ton better and your exercise program is going well, then you can start learning to become a runner or any other kind of new activity that you haven't done before. Postpartum care. So we do a lot of the same kinds of things. If you have any postpartum pain, low back pain, neck pain, shoulder pain, any of that stuff, maybe from lifting or holding baby in very uncomfortable positions that we can help you out with, that's something that we certainly treat. We do some very comprehensive body mechanics assessments to make sure that you're lifting everything and moving very, very well. As I mentioned, I treat clogged milk ducts too. Many of the therapists we have on staff also treat clogged milk ducts. If you have any continued urinary incontinence, pelvic floor muscle weakness, or painful intercourse afterwards, or if that just sounds horribly scary after having a baby, I treat that too. Treatment of diastasis recti, and we also help you get back to your prior fitness level. That's more part of a sports and wellness program that we have here. I'll talk a little bit more about that later. Physical therapy, medical necessity. If you have pain, that's physical therapy. We do one-on-one sessions with a licensed PT, 40 minutes. We do a full evaluation to see everything that might be causing any pain, any muscle weaknesses that you might have. Even after I had my kid, my husband came here for physical therapy because he was starting to have some back pain just from all of the lifting and carrying baby that he was having to do, and he just needed a good core strengthening program. And now his mechanics are pretty awesome. As I mentioned, we do prescribe exercise according to your ability and your needs. It's covered by most insurance plans, and we definitely talk with your doctor back and forth about what care you might need and what's going to work best for you. We also have this brand new movement screening for pregnancy and postpartum. This is something that I recently developed. And as attendees of this seminar, if you register for this program in the next 30 days after today, then you can attend this for free. It's a 40-minute session. I run through with you, this is not if you're experiencing pain or anything, but I run through with you all of the things that we mentioned today to make sure that you can do them well. That includes walking, navigating stairs, so that's just going up and down a step and see how well your muscles are working there. Squatting mechanics, transferring from sitting to standing, some of those things that become more challenging or that you are concerned that you might not be doing well. Lifting mechanics from varying heights, including the floor. Transferring in and out of bed, and then pelvis support like I demonstrated with Tori earlier. If you are concerned that you are maybe not doing any of these or you want to be evaluated to see if you're doing them well, this program is definitely for you. And then I'll send you home with a couple of exercises that you can do in order to make some of those movements a little bit easier for you. Okay. Lastly, if you need further care after that, we have a wellness program. This really is designed for some good preventative care, and it's a means of getting you back to some of your fitness levels that you were experiencing prior to pregnancy. Okay, so this is not so much physical therapy based. This is more like we want to get you to the next level. We want to help you attain some of your fitness or activity goals that are not being impeded by pain or anything. It's more some very specific strengthening programs and such. If you sign up for this program, you have unlimited access to Breakthrough. You work with a physical therapist, so it's a little different from a personal trainer. You have somebody who's they have that doctorate behind their name in order to make sure that you're able to do all the things that you want to do. And we then customize a healthy pregnancy and postpartum program just for you to make sure that you're getting back to all your fitness goals. We have a couple of resources listed for you guys at the end, some websites that are really, really fun to peruse. They'll give you a ton of information about anything and everything that you want to know about pregnancy and postpartum and being new parents. There's some mommy groups. I never became a part of any of these, but I did become a part of my own mommy groups, and man, oh man, does it make a world of difference to know that you're not the only one out there who has a child who consistently wakes up at 3 o'clock in the morning. It's very, very helpful. People have all sorts of anecdotal tips to give you to get through any kind of problems that you might have while you're pregnant and postpartum, and what do you do with this little baby now that they're born and you have to somehow take care of them and get them through the world. It's very daunting. But There's a ton of support out there. Should we do the survey now or should we do the lab now? Where did Theo go? He ran away. They're in the folders? Okay. We'll kind of launch into the lab at this point, but please just make sure to fill out that survey before you leave, and you can leave it on the back table for us. The survey is in your blue folders. We don't know how to make this presentation better if you guys don't tell us. That's my kid, by the way. That's my favorite jacket for him. Okay, so for the lab, let me just back up. We'll just launch into it. We're going to start off the lab in here.